Nursing is the most respected profession. Nurses are known to be ethical, honest, professional at all times. Their job is to protect others, to only do what is good and what is right for the patient. Each and every day, they make a difference in their patient's life, in their community. Some may say that such a career is so rewarding. According to the American Association of College of Nursing, we are having a nursing shortage. There are many components as to why this is happening, but one reason is due to stress, or in other words, a burnout. What is a burnout? The term burnout was created in 1970 by a psychologist named Herbert Freudenberger. This term was specifically for people that were in the helping profession, such as doctors and nurses. In other words, people who sacrifice themselves for others. The term was used to describe the consequences of severe stress. The World Health Organization defines burnout as a syndrome conceptualized as resulting from chronic workplace stress that has not been successfully managed. It is characterized as exhaustion, having negative feelings towards the workplace. It is failure or inability to meet all work requirements. The ANA listed some possible causes for burnout, such as being overworked, being time pressure, or having conflicts with colleagues. Burnouts are strongly affecting the medical community. A study by the International Journal of Environmental and Public Health demonstrated that having a high rate of burnout has been causing a higher turnover rate. We are losing people to this stress, and it's all due to an unsustainable workplace. This syndrome is causing depression and even suicide. I want you to go on Google and do a search. I want you to search the top most stressful careers or the top most stressful jobs. Did you notice how nurses are labeled as second, third, 10th place? Therefore, all nurses are at a high risk of a burnout. Here are some signs and symptoms of a burnout.
The three key symptoms of burnout are exhaustion, cynicism and detachment, and lack of accomplishment. Here's where you should ask yourself some questions. Are you so tired that you can't do anything after work? Do you drag yourself out of bed to get to work or class in the morning? If you feel yourself answering yes to these questions, you may be feeling exhausted both emotionally and physically. Some physical symptoms to look out for that can indicate exhaustion include body aches, difficulty concentrating, feeling drained, and irritability. Extreme exhaustion often leads to our second key symptom, cynicism and detachment. A question to ask yourself is whether you've developed a negative outlook on work or school. Signs of cynicism and detachment can include a negative attitude, a loss of enjoyment in your work, isolation from colleagues and fellow students, feeling disconnected from others and your environment, and increased conflict with others. The third key symptom is lack of accomplishment. Do you feel like you can never catch up on your to-do list? If so, you may be demonstrating signs of feeling like your work is not important. You may see a loss in productivity. You may feel useless or ineffective and show poor performance. Some other symptoms of burnout syndrome include difficulty controlling emotions, not taking care of oneself, not eating properly, and experiencing headaches or blurry vision. It is important to find ways to prevent or cope with burnout, as studies suggest that if these symptoms are left untreated, they can increase your risk of obesity and cardiovascular disease. If you're relating to these symptoms, it's important to know you're not alone. In fact, burnout may be more common than you think. What do you think is the prevalence of burnout syndrome in high-stress sectors? A, 10 to 15%, B, 20 to 25%, or C, 45 to 50%? If you answered C, you're correct. Studies suggest prevalence among high-stress sectors such as healthcare to be as high as 46%.
As nurses, we have learned to prioritize the health of others. But we need to learn how to prioritize our own health. So here are some prevention strategies and coping to help out with burnout.
Coping and preventative strategies. The first strategy involves changing your work patterns. Recent studies have suggested that a main cause of burnout and stress is due to long hours of work. Take Jane, for example. Working extra hours at her job has caused her much stress. If Jane changed her work pattern by working less hours, taking more breaks, avoiding overtime, and investing more of her time into her personal life, she may find her job significantly less stressful and could avoid potential burnout. However, sometimes you can't afford to adjust your work pattern, which is okay, as there are many other ways to help reduce burnout stress. Another strategy is creating social circles. Social support is one of the most important coping strategies for burnout. Communicating with your colleagues, family, and friends can help them understand what you're going through. Together, you can make a plan to help gain back control of your work-life balance. Another common coping strategy is focusing on yourself and developing relaxation strategies. This can include learning new breathing exercises, trying out yoga or meditation, or discovering a love for music and art therapy. Lastly, it's important to prioritize health and fitness. Getting exercise and following a healthy diet is crucial for maintaining your overall health. Although physical fitness is extremely important for your well-being, prioritizing your mental health is just as important. Working on your mental health may include making more time for your personal life or finding a new hobby that brings you joy. Additionally, it's recommended that adults get at least 7 hours of sleep each night to prevent exhaustion and maintain proper energy and focus for the day. Now let's get back to Jane. What do you think she should do to manage her burnout? Should she A, quit her job, B, communicate her feelings with her manager and family to develop a plan to reduce her stress, or C, work harder and hope for a promotion? If you chose B, that's a great option. Jane decides to have a discussion with her boss, and they are able to establish a plan that takes more work stress off Jane and allows her to regain her enjoyment of coming to work.
I want you to say this with me. Self-care isn't selfish. To learn more on self-care, please watch Katie's presentation. Let's no longer keep things to ourselves. Let's talk to others. Ask for help. Taking care of ourselves will not only just improve our quality of life, but as well as our patients' quality of life. To give proper care, we have to have a well mindset. Our brain has to be clear of all distractions. Let's do a summary of what we learn. Nursing is stressful. Nurses are leaving their jobs due to burnout. Some signs and symptoms are exhaustion, cynicism and detachment, and lack of accomplishment. To cope and prevent burnout, invest in your personal life. That means taking care of your health and doing exercise, spending time with friends and loved ones. Lastly, I encourage you to learn more about burnout. Here are some great websites that I found. Aspen University really breaks down what burnout is. And as you scroll down, it will tell you exactly how to know if you have it and what is causing it, if you're at risk, and it'll also tell you how to manage it. Mayo Clinic had some great coping methods on how to control burnout, so check that out as well. Once again, here I have listed some of the recommendations, and you can also check my citation for recommendations as well. I want to thank every single one of you for tuning in.